Driminate, also known as Dimenhydrinate, is an antihistamine medication that is commonly used to prevent and treat nausea, vomiting, and dizziness caused by motion sickness. It should not be used in children younger than 2 years unless directed by a doctor. The usual dosage for adults is 50 to 100 mg every 4 to 6 hours, while for children over 2 years old, the dosage should be determined by a doctor. It is best to take Driminate with a full glass of water. It is recommended to take this medication 30 minutes before travel to prevent motion sickness. Always consult with a healthcare professional for the appropriate dosage and timing. When taking Driminate, always follow the directions on the product package. If your doctor has prescribed this medication, be sure to take it as directed. If you have any questions about how to take Driminate, don't hesitate to ask your doctor or pharmacist for guidance. You can take Driminate by mouth, with or without food. If you are using the liquid form of this medication, be sure to measure it using a special measuring device or spoon. Avoid using a household spoon, as it may not provide the correct dose. Chewable tablets should be chewed thoroughly before swallowing. The dosage of Driminate is determined by your age, medical condition, and how well you respond to the treatment. It's important not to increase your dose or take this medication more often than directed by your doctor. If you are using Driminate to prevent motion sickness, it's recommended to take the first dose 30 to 60 minutes before starting the activity that may trigger motion sickness, such as traveling. Remember to inform your doctor if your condition does not improve or if it gets worse while using Driminate. If you experience drowsiness, constipation, blurred vision, or dry mouth/nose/throat while taking Driminate, be sure to let your doctor or pharmacist know. To relieve dry mouth, you can try sucking on sugarless hard candy or ice chips, chewing sugarless gum, drinking water, or using a saliva substitute. If your doctor has prescribed Driminate for you, they have determined that the benefits outweigh the potential risks. Many people who use this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects, such as mental/mood changes, like restlessness or confusion, fast/irregular heartbeat, shaking, or difficulty urinating. Seek medical help right away if you have seizures or a serious allergic reaction, including rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to discuss them with your doctor or pharmacist. Remember to always seek medical advice about side effects and report them to the appropriate health authority. Before taking Driminate, it's important to let your doctor or pharmacist know if you have any allergies to dimenhydrinate, diphenhydramine, or any other substances. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so it's best to talk to your pharmacist for more information. Before using Driminate, make sure to inform your doctor or pharmacist about your medical history, especially if you have breathing problems, high pressure in the eye, heart problems, high blood pressure, liver disease, seizures, stomach or intestine problems, an overactive thyroid, or difficulty urinating. Driminate may cause drowsiness or blurred vision, and combining it with alcohol or marijuana can increase this effect. It's important to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. You should also avoid alcoholic beverages and talk to your doctor if you are using marijuana. If you are planning to have surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's also important to note that liquid products or chewable tablets of Driminate may contain sugar and/or aspartame, so if you have diabetes, phenylketonuria, or any other condition that requires you to limit or avoid these substances in your diet, it's best to ask your doctor or pharmacist about using this product safely. Children may be more sensitive to the side effects of Driminate, and it can often cause excitement in young children instead of drowsiness. And, older adults may be more sensitive to the side effects of this drug, especially drowsiness, confusion, constipation, or trouble urinating, which can increase the risk of falling. If you are pregnant, Driminate should only be used when clearly needed, so it's important to discuss the risks and benefits with your doctor. And if you are breastfeeding, it's important to consult your doctor before using Driminate, as it can pass into breast milk and may have undesirable effects on a nursing infant. It's important to be aware of potential drug interactions that may affect how your medications work and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Driminate include antihistamines applied to the skin, such as diphenhydramine cream, ointment, or spray. It's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Also, check the labels on all your medicines, such as allergy or cough and cold products, because they may contain ingredients that cause drowsiness. Additionally, Driminate may interfere with certain lab tests, possibly causing false results. Make sure to inform lab personnel and all your doctors that you are taking this medication. As for the optimal timing to take Driminate, it is best to follow the dosage and timing instructions provided by your doctor or pharmacist. If someone has taken too much Driminate and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek medical help immediately. In the US, you can call the Poison Control Center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, seizures, and widened pupils. In children, you may notice changes in their behavior or mood, such as restlessness, irritability, or hallucinations, before they become drowsy. It's essential to get help right away if you suspect an overdose. Remember to keep all your medical and lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. If you forget to take a dose of Driminate, take it as soon as you remember. If it's close to your next scheduled dose, just skip the missed one and take the next one at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Driminate, it's important to keep it at room temperature and away from moisture and light. Make sure not to store it in the bathroom, and if you have the liquid form, do not freeze it. Keep all medications out of reach of children and pets. When it's time to get rid of Driminate, don't flush it down the toilet or pour it into the drain unless you are instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.